Hello, this is Dr. Bill Owens, and thank you for joining me on the Science of Chiropractic podcast. I wanted to take a moment now to simply introduce myself, give you a little background on who I am, where I've come from, and why this topic of supporting chiropractic with science and research is so important. Ultimately, we're going to keep these podcasts to about 20 minutes. I think that's important because most likely most of you, just like I do when I'm listening to podcasts, I try to fit them into my busy day. I try to handle and watch them, listen to them, on the way to work, on the commute, maybe on the way home, or when I'm on the treadmill. So I think 20 minutes is probably a good shot. So when it comes to background, I've been in practice. I'm going into my 21st year. I am a 1998 graduate of National College. And what was interesting is, regardless of where you feel you are on the paradigm of philosophy, schools, clearly I was a little bit more left in the chiropractic profession compared to others on the political spectrum, so to speak. However, my background really had changed quite a bit after I had left Chicago. And what I did was, at the beginning, as any new practitioner, I really struggled. Struggled to find a place, struggled to find, where not only do I fit into chiropractic, but where does chiropractic fit into the community? And I started out early hanging around with a lot of chiropractors and talking chiropractic business, chiropractic philosophy. We all tried to learn from each other. But one of the most pivotal events that I had in my career was early on. We had a city-based hospital chiropractic department. We had the bylaws changed. We actually had a small wing that was all chiropractic. And, that was an important time because what it really did was introduce me to the medical profession. And back then, 20 years ago, the environment wasn't even close to embracing as it is now. And I'll get into that in subsequent podcasts. But one of the radiologists at the hospital clinic, when we started, we had no patients. I was brand new out of school, and I was one of the people that founded the clinic. So it was a huge learning experience. But, what I realized was that we didn't really market to the public in that system. We couldn't go out and just talk to patients sitting in the waiting room or put on a guest lecture or any of those types of things. We are sort of forced to market or educate the providers because those were the ones that were referring in. And at that time, and even to a certain extent now, there's a lot of confusion as to where chiropractic fits. Is it chiro PT? Is it chiro massage? Is it acupuncture? All of these things. And, over the years, in order to make that clinic successful, we really had to interact with the specialty medicine department, which was orthopedics, podiatry. We talked to the internal medicine doctors. We talked to the surgeons. And that advocate, that radiologist was a huge part of that education. And when I do my consulting at the MD referral program, that's really what that's about, is taking all of that experience and bringing it to the rest of the chiropractic world, right? Because not all of us are lucky enough to be in that position. Maybe it's not so lucky because it's a lot of frustration and a lot of angst. But over time, what I realized is working in the medical community, and this is coming from a National College of Chiropractic background, I was able to learn to be more of a chiropractor working with medics than I ever had been working alongside other chiropractors. And that's an interesting paradigm because it's sort of the opposite of logic. It's the opposite of maybe conventional wisdom. And I've certainly had my share of discussions with people on the phone, via email and live about that. But what really makes chiropractic work, what the true essence of chiropractic is what really fits into the greater healthcare model. Medicine doesn't have any of the answers for what we do, the conditions that we treat, and the diagnoses that we render. So even though I had a very liberal type of chiropractic education, my practice life had certainly become very conservative on the chiropractic paradigm or spectrum. You know, a little bit of modalities, but a lot of biomechanical diagnosis and adjusting. And that's kind of what we do. And I still practice full time. I have 2 associates with me now. And we're a very, very busy clinic. We have 9 treatment rooms. We operate every day. We treat every day. And, you know, 90% of my referrals come from the medical community. You know, 80% of my personal injury cases come from primary care physicians. And we're going to talk a lot about those things. You know, those are things that, you know, I consult heavily on. But I want to expose them to you because it's a great and it's a fun way to practice. You just can't be full of crap. You know, you have to be educated. So on my background, you know, one of my first faculty positions was, believe it or not, with a medical school. I'm currently adjunct professor at University of Buffalo Jacobs School of Medicine in the family practice department. Our office and me in particular, we handle medical student rotations 3rd and 4th year. We also have a family medicine, family practice resident rotation, and those are the students that have graduated medical school and are at close to the end of their 3 years in family medicine, and they rotate with us. And there's also a neurology rotation set up as well. Neurology is a little bit different. Their focus really is on movement disorders now and stroke, you know, Parkinson's and things like that. Not so much spine, but there's some stragglers out there. I'm also faculty at University of Bridgeport College of Chiropractic. I'm also faculty at Texas Chiropractic College and also Cleveland University, Kansas City College of Chiropractic. And it's those faculty positions that really kind of keep me motivated. And I think my desire is to bring together interprofessionally both medicine and chiropractic to really ultimately help patients, right? It's not about me becoming a medic or you becoming a medic or even the medics becoming chiropractic or teaching medical doctors how to be chiropractors. They don't want to be, just like we don't want to be medics. So, you know, throughout the years that has evolved. And early on, I went through the orthopedic diplomate. You know, when I first got out of school, I jumped right into 2 major things, the orthopedic diplomate and state politics. And we'll have another discussion on another podcast about the state politics issue, and that's precisely why I've become more of an academic in practice and in my social life. But that's for another time. But on the orthopedic diplomate side, you know, I went through a little over half of it. And unfortunately, one day they came to me and said, the curriculum has changed and there is no transferring over of seminar materials. So that kind of irritated me a little bit, to say the least. But, you know, in reflecting back, I had a choice, right? I had a choice to just suck it up and continue. Or I had a choice of just sort of reflecting on what that first half of that diplomate gave me. You know, because when I was at the hospital and I was talking to medical doctors that were referring into our clinic, primary care, internal medicine, emergency department, and talking about a diplomat, nobody knew what that was. You know, chiropractic, you know, sometimes we're really good at inventing very important niches for ourselves that are really sort of outside of what medicine normally understands. And, you know, I really thought about that a lot. And one of the things that medicine does, like it or not, and this isn't a philosophical discussion, it's more of an academic one, is 20% of medical education is in medical school. And that's all the background. And it's pretty equivalent to what we do. We're pretty equivalent to it. However, where we differ immensely is on residency training. That's the clinical side. That's the doing side. And of course, we have our resident internship training. And it's a very, very big part of who we are and what we know. However, when I got to the postgraduate level, I noticed that chiropractic globally, or even more so in the United States, was really far behind what medicine had developed for them. And I'm not saying that we should be like them, but I think we have a duty to the chiropractors that are practicing, and we also have a duty to the chiropractors that are coming through the ranks and learning to be able to train them at the highest level, right? Because we're a real profession. We're not just a spinal manipulation modality. We're not technicians. We're not therapists. So, I was kind of bummed out, so to speak, about the lack of clinical training. I could have gone through those 3 1/3 years of orthopedic diplomate training, but it was all classroom. You weren't seeing hot discs. You weren't seeing positive straight leg raises. You weren't seeing myelopathy. You weren't seeing myomalacia. You wouldn't see somebody, on a table stroking in front of your very eyes because they walked in with a headache. So those were a lot of experiences that medicine has that we don't get in our postgraduate. And that's the place for it, by the way, is in the graduate level, not in the current, chiropractic curriculum. So over the years, I really struggled with this. And about 4, maybe 5 years ago, I started with Dr. Student in the Academy of Chiropractic, and we really started developing graduate level coursework. And that can all be found at teachdoctors.com. But that ranges from MRI, spine interpretation, spinal biomechanical engineering, stroke and vascular diagnosis, triaging, all of those things that were critically important, are critically important to practice life. And it wasn't just him or I doing the lecturing. We brought and we continue to bring top level instructors. These are neuroradiologists, surgeons, orthopedic surgeons, neurosurgeons, vascular neurologists, and these people that really have the credibility to teach, and we can bring them to you. So that was the didactic portion. Then I realized, we still need that clinical component. So what I started about 2.5 years ago was a fellowship in spinal biomechanics and engineering. And if you want more information on that, you can go to my website, mdreferralprogram.com, or you can certainly email me at dr.owens@academyofchiropractic.com, and we can have a discussion. But we do a series of 8 rotations: pain management, MRI, TAC, neuroradiology, orthopedics, neurosurgery, internal medicine, emergency departments, and all of those rotations are done in your own community. It's all evidence-based. You're going to read a lot of research, but what it really gives participants is a full immersion as a chiropractor into the local health system. And that's been pretty important. So directing the fellowship on top of my faculty positions has been a real joy. I continue to do that. It's a tremendous amount of work and a little bit of stress along the way, but the doctors that are going through it, their practice life has never been the same. Lastly, one of the things that I'm also doing, and I'll finish up here shortly, is working with Dr. Ray Wiegand. Dr. Ray Wiegand is a chiropractor in St. Louis. Ray has been in practice for quite a long time. I don't want to put a number on it because you'll probably kill me. But Ray in 1984 was the first chiropractor to really develop and take all of the founding fathers' work for spinal x-ray. Logan and Gonstead and all of those people, and bring them into the computer age. And what he was able to do is create a computer program that will analyze the spine, and it will show and objectify chiropractic subluxation, sagittal balance, and really where the optimum placement of the spine should be. And we'll get into this on subsequent podcasts, but I'm currently working with the School of Engineering at the University of Buffalo. We're published at this time, which is September of 2018. We're on our 4th engineering research paper on bringing this to the clinical setting. And that's really the future for chiropractic. When I talk to medical doctors about actually objectifying the lesion that we treat, the floodgates of referral open. So there's a lot of really important things that are coming down the road, a lot of really good research. We have great researchers that are getting busier and busier in our own profession. I personally believe we have a long way to go. But it's really only through the marriage of academics and clinical practice, I believe, that we're going to have any influence long term. Politics has certainly failed us. Changing who we are is just something that divides us. And I think it's the science, the true science of chiropractic that will validate us. And, I've sat around with Dr. Student on multiple occasions, and, we've realized that it's not going to be chiropractors that validate chiropractic, right? It's really going to be the medical profession. And what I'm seeing now, as a matter of fact, tomorrow, I'm doing an entire roundtable mastermind seminar for my clients in the medical school. The assistant dean of medical education is going to stop by. The hour before, we're going up to the vascular lab, the vascular institute where the neurosurgeons work, and we're going to meet all of them and the residents. And we're completely, fully embraced. And I think that patients need more chiropractors to be that involved. I would certainly like to work with you to help you to do that. So these podcasts are going to be free to the chiropractic profession. And it's not a gimmick. It's not about a new marketing trend. It's about being the best of the best clinically. It's about building relationships on academics and truth and science. And believe me, everything that was written in those green books all those years ago is starting to come out in real science. And what the science is doing is supporting the foundation of who we always were and who we are today. So whether your philosophy is straight or mixer, whether you're a low back pain guy or you have a corrective care clinic, whether you do Pedibond or you do Activator or AK or you have a nutritional practice, that's great because that's all chiropractic. And where we all will come together is through the science, our ability to diagnose and manage patients with acute and chronic spine conditions. And that's the future. There are more patients in medical offices that need us than anywhere else. And if we can understand the science ourselves, and then we can teach that to the medical community, your practice will never be the same. So I thank you for joining me for this short introduction. There's a myriad of topics that I'm going to continue to discuss and come to you with. If you have comments, you have questions, my cell number is 716-228-3847. You can certainly call me at any time. If you don't get me, my service can schedule a time for us to talk, or they'll just take a message. You can email me again at dr.owens@academyofchiropractic.com, or you can actually go to my consulting site at mdreferralprogram.com and just hit the live chat window, and I'll get that message as well. If I'm not attending it live, then I'll get an email on that. So thank you so much for taking the time. I hope your day is as good as mine is, and I wish you all the best of luck. And please keep learning about chiropractic and promoting the science of what we do every day. Thank you.